Have any of you ever broken a bone or had to receive an x-ray? I'm going into radiology and I'm hoping to become a radiologist technician. I've been able to take many classes in this field and have learned a lot about different radiology exams. To give you more of an idea of what radiology exams that you could be having in the future, I decided to cover some of those today. But first, I'm going to cover what a radiology exam is, and what do radiology exams do, and different types of radiology exams. But first, let me cover again what a radiology exam is. According to the National Cancer Institute, which is our nation's leading federal agency for cancer research, a radiology exam is a test that uses radiation or other imaging procedures to find signs of cancer or other abnormalities. So radiology exams are not only for finding cancer, but for other abnormalities. Other abnormalities can include a variety of different health concerns, such as if a bone is broken, the cause of vomiting, or if there's a torn ligament or tendon in the knee. Well, how do radiology exams work? Some radiology exams use electromagnetic radiation. For example, on the National Library of Medicine website, which is the largest biomedical library, it explains that X-rays are a type of electromagnetic radiation. The electromagnetic radiation then sends X-ray particles through the body and then creates the image. These images then show, as talked about before, what the diagnosis is. Well, as I said, some radiology exams do not use radiation. For example, MRIs, or their full name, magnetic resonance imaging, they do not use radiation. MRIs actually use strong magnets and radio waves to create pictures of the body. Well, now that we covered what a radiology exam is and how they work, I'd like to go over a few radiology exams. The first radiology exam I'd like to go over is a computed tomography, or also known as a CT scan or CAT scan. On the website radiologyinfo.org, which is an organization that helps explain radiology exams to patients and what they may experience, it gives the information that CT scans are similar to X-rays and that they create multiple pictures of the body by using electromagnetic radiation. A patient will lie on a bed-like surface, and then will go through a donut-shaped tunnel, as the one shown here. The electromagnetic radiation then sends information to the computer to create images. A CT scan usually takes less than 5 to 10 minutes. This is very useful when there is a traumatic situation and we need to know exactly what the problem is in a patient. For example, you can find kidney stones in a CT scan. Another radiology exam I'd like to go over is known as mammography or a mammogram. On the website radiologyinfo.org, it says mammography is a specific type of breast imaging that uses low-dose X-rays to detect cancer early when it is most treatable. Breast cancer has become really high. On breastcancer.org, which is a nonprofit organization that keeps the most up-to-date information on breast cancer and breast health, it says that 1 in 8 U.S. women will develop invasive cancer in the course of their lifetime. That is why it is extremely important for women to receive mammograms. The last radiology exam I'd like to go over is known as an ultrasound. According to the information on radiologyinfo.org, the way an ultrasound works is by an ultrasound tech holding a handheld probe, or also known as a transducer. The ultrasound tech will then use the transducer to go over the part of the body that needs to be seen. Ultrasounds do not use radiation. Ultrasound images are made by high-frequency sound waves that reflect off the body and then are sent to the computer to create images. Ultrasounds can be used for a variety of different reasons. One of the reasons is it can be used to check the health of a fetus and while it's growing in the mother's belly. It also can check if there's any abnormalities. And finally, it can also check the gender of the baby. Another way ultrasounds can be used is by checking for what we call a DVT, or also known as a blood clot. Ultrasounds can pinpoint exactly where the blood clot is and see if it's concerning for the patient. These radiology exams are only but a few of what radiology exams you could be having in the future. Now that you know more about radiology exams, let's conclude. Since you most likely will have radiology exams in the future, I hope that learning about what radiology exams are, what they do, and a few different types of exams has opened your eyes to the importance of this field. Radiology exams will continue to be an important tool in the medical field, and now when you will need one of these exams, you are informed on what this exam does. Any questions?
Yes. Is there a specific age that's recommended for women to get a mammogram?
That's an excellent question. I actually looked on the American Cancer Society, and they suggest that women should receive a mammogram at the age of 45. And then they should receive a mammogram every year until the age of 54. But they also recommended if you have had breast cancer run in your family and you feel more comfortable starting to get mammograms at age 40, you can do that as well.
Thank you.
Any other questions?
Is an ultrasound at all harmful for the mother to the baby?
No. So ultrasound, since they do not use radiation, it's not harmful to the baby or to the fetus. Or to the mother is what I mean. It shouldn't be harmful at all because what they use is sound waves instead of radiation.
Can radiation be harmful at all?
I looked into this too, and I looked at the Health Physics Society, which is a nonprofit scientific professional organization, and it said the only time that radiation can be harmful is if you get radiation in large doses, such as if you've been around military weapons that have contained nuclear weapons, is what I'm meaning, or if you've had an accident or used radiation for medical purposes. But it should be okay unless you've had any of those, because radiation can cause dizziness, headaches, or even death, but you should be fine.